So Dr. Uktra, what exactly is HIFU and how is it different from other skin tightening treatments?
The first is the depth of penetration. Now, HIFU goes very deep, up to 4.5 millimeter in depth, which is a SMAS layer. Now, this is the plane where usually surgeons or plastic surgeons do facelifts.
Right.
So then this can go much deeper. So it is non-invasive. A lot of patients don't want to do plastic surgery or any surgical intervention. So this is a good non-invasive treatment for them if they have mild to moderate laxity. And there is no downtime. You can actually go to a clinic, get HIFU treatment and walk out and go back to work.
Right.
Yes. Very rarely you might see a bit of swelling, which will subside in about 2-3 days.
Okay.
So basically it's like a lunchtime treatment. There is no downtime. There is no surgery involved.
Right.
No knives involved. So these are some of the positives where people are looking for. And it's a great alternative to other treatments, because for microneedling or laser treatments, laser resurfacing, sometimes you do have scab formation, etc.
Right.
There is a downtime for up to 2 to 7 days for them. So with HIFU there isn't any.
Okay.
And like I said, it goes much deeper. So there's collagen and elastin production over there. And the important point is with HIFU treatment, it does take a little longer to see results, because it starts working in a month or so.
Yeah.
But the results are longer lasting, anywhere from 6 months to 1 year.
Oh.
Yes.
Okay.
So you do get one treatment in like once or twice a year rather than every month or every couple of months.
Yeah, that's really good.
Yes.
Doctor, who should consider HIFU, and is it for only mature skin or younger people can benefit too?
Okay, great question. So it is ideal for mature skin, especially women in the 30s and 40s, starting from that age, because as we age, you know, collagen kind of decreases over time. And anyone who has mild fine lines or a bit of skin laxity can think about doing HIFU. It's great for collagen and elastin production, will give you a slight tightening effect. So it's ideal for women in that age. If you're younger, it's still a good treatment. For example, anyone in your late 20s to early 30s can also take HIFU as a preventative treatment.
Okay.
Like I said, again, collagen starts decreasing when you're in late 20s. So HIFU can actually prevent aging, which is a normal progression. So it can delay aging over time by boosting collagen even when you're much younger.
Okay.
Yeah. Another point to consider is patients who are looking for facelift but do not want to undergo surgical intervention. So that's good for them as well if you have mild to moderate laxity.
So doctor, what areas does HIFU address? Is it only for sagging skin or any other purpose also? Like I saw a reel where there was major weight loss transformation, and for sagging skin to tightening, they use HIFU even on the belly area. So is it only for facial or other body parts as well?
Oh, it's quite an interesting question.
Yeah.
Well, yes, primarily I would say HIFU is great for mild to moderate laxity.
Okay.
So if there's mild sagging or moderate sagging, it's good for tightening and, you know,
shaping,
contouring.
Yeah.
And it goes really deep into the SMAS layer, which is 4.5 millimeters. So that's the layer where there's a surgical intervention or surgical facelifts that takes place. So when it goes that deep, it helps to tighten that area. And superficially, like about 3 millimeter, 1.5 millimeter, it causes collagen production.
Okay.
So therefore, it's used for tightening and contouring, and also for skin texture.
Okay.
Like 3 mm or 1.5 mm, it's used for fine lines around the eyes, for improving your skin texture with pores, etc.
Okay.
It's great for to prevent jowling or to contour your double chin area.
Right.
So it's good for that. Another area that HIFU is good for is to decrease puffiness around the eyes.
Okay. Yeah.
So these are some of the areas. Oh, thinking about the question you did ask me is about major weight loss, isn't it? So see, after major weight loss, if there's excess amount of skin, HIFU is not going to help tighten.
Okay.
Like I said, mild to moderate laxity.
Right.
Excessive amount of skin, you need to address it with surgical intervention, obviously, because HIFU alone cannot tighten it. So there's a misconception that HIFU can do it all. It can't remove all the excess skin.
Okay. So what does the treatment actually feels like during a session? Is it completely painless or there's some discomfort to the patient?
It depends actually from individual to individual and what your pain tolerance is.
Okay.
We do require a bit of patients to apply a bit of numbing cream prior to the treatment. And the initial stages, obviously, patient does feel a bit of pricking sensation.
Okay.
And as we go deeper in, they describe it as a deep pulsating sort of not pain exactly, but a sensation. The deeper you go, if you feel it a bit more. For example, especially around the jawline, where we go about 4.5 millimeter depth, you do feel a bit of that pulsating feeling and a bit more pricking sensation, the superficial part. Post procedure, of course, they feel a bit of tenderness around that jawline for about a couple of weeks, and then it subsides.
Okay.
Yeah. Other than that, there's no deep pain or there's no intense pain to it. Just mild discomfort will be there. Like I said, again, it will depend on the patient.
That's manageable, I guess.
Very, very manageable. With a bit of numbing cream, people are quite comfortable during the treatment.
Right. Yes. So, Dr. HIFU is growing as one of the most popular treatment for anti-aging, and on the other hand, Botox and fillers are too for anti-aging. So, can HIFU be a substitute to Botox or fillers, or it's just a complementary treatment?
So, HIFU it's not a standalone treatment. It has to complement other treatments. For example, HIFU, like I mentioned earlier, is good to addressing skin laxity, for skin texture, and also for tightening and contouring. A Botox, like in my other podcast, we did have a conversation that it is for dynamic lines and wrinkles. So to prevent those lines from becoming more permanent, we do use Botox. Whereas fillers are completely different. So if a person comes with very gaunt face, like they've lost a lot of volume from their faces, it's for filling those faces and also contouring. So each have their own different I would say use in anti-aging, and then all three of them are used as they're complementary to each other.
Okay.
So I would say you can't just use one treatment. Initially you can, but they all have different uses for different indications.
So doctor, the other side of the picture is quite different for HIFU, that people are showing over the internet that after even 2 or 3 sessions of HIFU, they are not getting results. So what is the major reason you think behind this?
So the major reason could be, number one, your practitioner. Like I mentioned, if you are going to get any sort of treatment, always do your research, be well informed. Who's doing the treatment? A lot of times I have heard that therapists, like skin therapists, are doing HIFU treatment. They don't know how to assess the facial features properly. They wouldn't know which depth to go through. It's like a sort of cookie cutter thing for them. Like I'll do 4.5 mm, these many shots.
Okay.
So one sort of blueprint is not for everybody. Every face is a bit different. So the number of shots or the lines that you're giving per person for different levels would also alter accordingly. So yes, number one.
And some are using substandard machines, I guess.
Yes. Number two, I was coming to that.
Yeah.
Number two is using not machines that are substandard, or that won't give you any result as well, because you need high energy devices that delivers the required energy for collagen production and for skin tightening.
Absolutely.
For example, I'm using Dublo Gold. It delivers energy between 60 and 70 degrees centigrade, bypassing the top layer of your skin to much deeper structures, to the SMAS area. So that would tighten the area and also cause collagen and elastin production for your skin texture. So that's another reason you do have to have the proper machinery. Just going else to any clinic, giving a very low cost HIFU is not going to do the deed. I mean, you are going to be paying 2-3 times. And then you're not going to get any result. What is the point?
So what do you use at Hana Clinic?
I'm using Dublo Gold.
Okay.
Yeah. It's a good brand, and I do see results. Patients are happy with it as well.
So with your machine, how long does the effects of HIFU last, and how often do patients need to revisit for the treatment?
Okay, so with our HIFU machine, generally depends on the patient especially and what the goals are that they want to achieve.
Right.
The results can last anywhere from 6 months to 1 year. After the treatment, the results do take a little bit of time to come. So it takes anywhere from 1.5 to 3 months, and then it lasts for 6 months to a year.
Okay.
So generally, if it's a patient who has a very heavy set face with at least moderate laxity, we do need to repeat the treatment every 6 months.
Okay.
If it's a younger patient, like I mentioned, who wants to just a preventative HIFU treatment, then once a year is more than enough.
All right.